STDs when you're pregnant. Of all the STDs in the United States, genital herpes accounts for half. There are two types of herpes viruses, type 1, which causes oral herpes, and type 2, which causes genital herpes. Condoms have been found to decrease the risk of transmission by 50%. It is important to remember that a condom only protects the area that it covers. There is no cure for oral or genital herpes. You get oral herpes and genital herpes by skin-to-skin contact with someone that has active lesions that contain the herpes virus, or by an active viral shedding of the virus that cannot be seen. Newborns can become infected with the herpes virus in 3 ways: in the uterus, passing through the birth canal, after birth. 3 subtypes of natally acquired or postnatally acquired infections have been identified as disease localized to the skin, eye, or mouth, encephalitis with or without skin, eye, or mouth involvement, disseminated infection that involves multiple sites, including the central nervous system, lung, liver, adrenals, skin, eye, or mouth. Babies can become infected with the herpes virus in the uterus. This is called congenital herpes. If you do not have herpes when you become pregnant and contract it while you are pregnant, the virus can pass to your baby in the uterus through the placenta. Congenital herpes is rare and happens less than 1%. The risk of the baby catching the herpes virus while in the womb goes up as high as 30 to 50% if the mother contracts the virus while pregnant and has her first outbreak of genital herpes during the final 3 months of pregnancy. Why? 3 reasons. The patient sheds the virus for a much longer period during primary herpes infections. More viral particles are excreted during a primary infection as opposed to a recurrent infection. The mother hasn't developed antibodies to the virus yet and therefore hasn't transferred any antibodies to the baby through the placenta. If your baby does contract genital herpes, you can have a miscarriage, your baby can have serious birth defects, or it can suffer from mental retardation. In these primary herpes cases where viral shedding may be occurring, a C-section is. This is an operation in which the baby is removed by the mother's womb by surgery on the abdomen. A C-section alone does not completely remove the risk of transmission of the herpes virus to the infant. Rupture of membranes for more than 4 to 6 hours before delivery increase the risk of transmission to the infant. The more common way for a baby to get the herpes virus is from labor and delivery. This is called neonatal herpes. Most cases of neonatal herpes occurred because the mother didn't know she had the herpes virus. She had asymptomatic cervical sheddings of the virus, usually after a primary episode of the herpes virus infection, and gave birth without the proper precautions. If you have had a long-standing herpes infection, you are at low risk for transmitting the virus during labor and delivery. This is because your body has developed the antibodies to the virus, which are also passed through the placenta to the baby. Up until your water breaks, the baby will be protected by natural membranes. Neonatal herpes generally occurs when the virus comes into contact with the baby's skin during childbirth. If you have no sores along the birth canal when you go into labor, then you may have a normal vaginal delivery. To increase the chances of having a vaginal delivery, a woman may take a virus suppressor medication during the last 4 to 6 weeks of pregnancy, such as acyclovir. Acyclovir has been shown to reduce viral shedding in excess of 50% in some patients, reduce breakouts, and has not been associated with birth defects. All newborns suspected to have or who are diagnosed with HSV infection should be treated with parenteral acyclovir. The last and final way a newborn can get the herpes virus is after birth. Get tested, get informed so that your baby is protected.